Hello, I am contestant number 8237, and today I will be competing in practical nursing. I'm going to go ahead and begin washing my hands to prevent any infectious diseases or bacteria to spread from in between patients. I will be washing my hands for 30 seconds. Make sure to get off any bacteria or germs that I have on my hands. Now that I went ahead and washed my hands, I'm going to go ahead and introduce myself to the patient and make sure that I have the correct patient. Hello, Emma. I'm going to be your nurse today. I'm going to go ahead and check your identity really quick to make sure that you are my patient. Emma Perez, 01/23/1995. Perfect, you are my patient. So I'm going to explain the procedure really quick. So technically, we're just going to go and clean your trach area. I'm going to be replacing your gauze and your trach ties, as well as cleaning your in-ear cannula. We can start in a bit. I'm just going to sanitize my hands and clean off the table really quick, and we'll be ready to go. So how's your day, miss? How you been today? That's amazing. I'm glad to hear that my patients are always feeling well. I'm gonna make this procedure as comfortable as I can, and if you feel uncomfortable at any time of the procedure, please let me know so I could fix your position at all, or whatever your needs are. I'm gonna go ahead and get my supplies now and just sit here, and I'll be right back. So I'm gonna lay this out now. And we're gonna begin. Now that I have all my supplies with me, I'm gonna go ahead and sanitize my hands. Make sure to get those germs off. I'm gonna go ahead and put on some gloves as well. And then we'll be able to start. Alright, I'm gonna move this table to the side now. And make sure all my stuff is ready. So first, I'm gonna go ahead and check this for if there's any cuts or openings here, just to make sure that it stays sterile. But it looks like we're fine, so I'm gonna go ahead and open it. Put this aside. I'm gonna throw this away actually. And get the tray out. Move this aside. And lay this out. Now from the borders, I'm gonna dump my supplies onto my sterile field right here. And I'm gonna put this aside. This is fine right here. And with the palm against the label, I'm gonna go ahead and open the saline so I could put it in here. You want a good amount just so I could take their cannula out and give it a saline bath. I'm gonna go ahead and do that right now. Put it in here. Now, with this, I'm gonna just throw away my gloves now, and I'm gonna sanitize one more time before I put on my sterile gloves and start cleaning around and under your faceplate and taking off your gauze. Now to put on my sterile gloves. Now I'm gonna put on my sterile gloves, starting with my dominant hand. And then my next hand. I'm gonna move this away with my elbow so I don't get anything non-sterile. And well, to begin with this, I'm gonna start by just taking off your gauze right here. So I'm just gonna start now. I'm gonna use my left hand, keeping my left hand the only dirty one. Just gonna snuggle this out. And then we don't need this anymore, so I'm gonna throw this one away. And since my right hand is still sterile and my left hand is not, I'm gonna keep my right hand as clean as I can. Now, we're gonna start and clean around your stoma, going out from the stoma, just so we could get out any gunk or bacteria in there. Most of the time there is some mucosa or something that could be blocking their way. Now with my clean hand, I'm gonna start and I'm gonna grab my Q-tip here and I'm gonna dip it inside of the sterile bath and go from up the stoma. And each time I do it, I throw this one away and get a new one. And I can do this as many times as I need just to get out anything in there that I need to get out. Coming from the stoma, out. Now, since with the same hand, I'm gonna pat around it and make sure that it's dry. And with this, I could also clean around your faceplate because most of the time you can get mucus on there or like some dry thing, not too hard, just stabbing the wetness off, making sure that there's nothing there. And then the top of your faceplate as well. Now, I don't need this either. This is throwing that away. Now, I'm going to clean the inner cannula with my dirty hand, the top of the cannula. And since I don't need to be sterile with my hand to carry this, I'm gonna grab the brush now. And I'll try getting with my right hand, the clean hand. Now, I'm gonna make sure to get inside and in the corner. It's kind of hard to get right here sometimes, but just gonna put that in there. I'm gonna clean the inside of it. Sometimes it can be a little bit hard, get what I need to get out. This was dipped inside of the saline. Now, since it's all wet, I'm gonna grab the pipe cleaner now, and I can throw this away. I can grab the pipe cleaner now and dry it everywhere that there's any wetness until I feel that it is dry enough to go back inside. Now, I'm gonna grab the little fringes right here on the side and push it in until I hear a click. There you go. Now, with my right hand, we're gonna start putting your 4x4 gauze back on to keep any of the dampness out or just to keep it right. And so we're gonna start with that first. And we're also gonna, after this, we're also gonna change your trach ties. But with this, I'm just gonna try to snuggle this under. I'm gonna lift this if I have to, just a little bit. And snuggle this in there. Sometimes it could be a little bit hard to get that in there. So I'm gonna pick it up a little bit with this left hand and just try to put that in there, snuggle it in there, and we're good. So now we're gonna change your trick ties. Now with this, you have to remember not to change the old ones out until this one's in to stabilize it, because sometimes the tray can be expelled and we don't want that happening. So I'm gonna go ahead and pick up your head really quick and then start this one right here. I'm gonna grab the faceplate just to lift a little bit to put the new ties in there. Perfect, okay. So we could tie this now. We want this to be as stable as possible without it choking or hurting your neck. Okay, perfect. Now we're gonna go to this side and do the same thing here. Perfect, in there. Now we're gonna grab it from under and tie this one up. Perfect. Tell me if that's a little too tight. That should be good. Okay, now that the new ones are in, I'm gonna finally untie the old ones here and take it off. Now that since we have it stabilized, nothing will be expelled or anything bad. Perfect. Now we can get this old one from over your head and we can throw this one away. So that is it with the procedure. You did amazing. Thank you so much. So we're done now, but if when you go home and you see any redness or you feel any discomfort, you could definitely come back and we'll check that out for you. This concludes my skill now, but before, I'm definitely gonna properly dispose of all of my supplies here and get rid of anything that needs to be get rid of. Again, I am contestant number 8237. Thank you for your time.